Rick Fuscone. This is the interview for the caregiver. Okay, so the research question is, what health-related information do patients look for when using online resources for this cancer website, which is cancer.org? So what are your first impressions when looking at the website?
I think it's quite effective, and the pictorials I think uh, are very expressive. I think, at least from what I can see right now, the navigation is very easy. I think it would be something that both patients, cancer patients, and their families could navigate through very effectively.
Okay, great. How does the layout make you feel?
Um, I think having been through the process with mom, my wife, and there's a comforting and somewhat of a deferential feeling of the website. I think it speaks to patients and families. So I think it's a very uplifting feeling that I have just by looking at it.
Do the colors on the website bring up any emotions?
Um, well, this is an emotional topic, so it's pretty easy to bring up emotions. But I think the colors are subtle and yet evocative of kind of the emotional response you would expect, but also not one of dark emotions. Something more constructive and positive.
What is your opinion of the photos on the website?
Um, Very expressive, hopeful, and I think they show a sensitivity to kind of the weight of the disease and the condition, and again, I think express some empathy with both patients, families, practitioners.
Okay. What information do you think should be on the website that is not currently present, if any?
Um, I think it covers the terrain very effectively. I also like, especially like um, this one segment on lung cancer survivor finds help through clinical trials. So it it's research oriented. It seems. I think it's again hopeful, and I think everybody looks for something different with regard to this disease and the idea of using innovative treatments, and for there to be testimonials of cancer survivors who have used that. I think that's a very effective approach to use on the website.
So the videos that you see, you don't have to click on them, but would you be inclined to click on them?
Yes, of course.
Okay. Would you go back here for information if needed?
Yes, I would. I could see this being something that to learn more about the condition and causes, solutions, survival rates, testimonies. Of course, I think this would be a very effective tool, and I could see referring to it myself.
Okay. Would you go back here for information if needed?
Yes, of course.
Okay. Did you learn something you would have not gained easily from a doctor?
Yes, because I think the website, from what I can distinguish, kind of raises the questions and tries to answer all the questions that a patient or his or her family would have.
Mm-hmm.
And I think is a great supplement to the direct consultation you would have with a physician, which oftentimes after you leave a physician's office, you remember 5 questions you didn't ask.
Right.
So I think it's a great complement. I don't think it should be a standalone, of course, but I don't think it's intended for that either.
Okay. Pretend that you were diagnosed with lung cancer. After being diagnosed, what kind of information would you be looking to receive online?
Well, I think numerous things. I think you'd want to look at all the treatment, all the treatments that are available, what the cure rates and survival rates of those treatments are. I think there's always second guessing of yourself as to what caused this, and was it in part something that on my behavior or my life
Right.
habits or whatever. And I think this website would answer that. So the questions I would have would be much more oriented to cures and to therapies, and that's why I think this is a very a comprehensive website to have available.
Okay, and if you start from the home page, do you see side effects of chemotherapy anywhere on the home page?
Let's see. No.
Okay. Um,
Which is a good topic to include, though.
right. Do you see the breast cancer quiz anywhere on the page? No, it's okay.
I don't.
Okay. So if you go to the top menu, to the right of the sign in, there's a button for register. Do you see that?
To the right of the sign in, I see search, live chat, and a phone number.
The very top. Register right there.
Oh, yeah, sorry.
Okay. What information would you expect to find there?
Under register,
Mm-hmm.
I guess it would be all my personal information.
Right.
Something I could easily refer to if I needed it for either a doctor's appointment or something else.
Right. Do you think referring back to the homepage makes the website easier to navigate?
Yes, I think it does.
Okay. Thank you so much.